The fact that people are not thinking of COVID, it came down in numbers, but even at its height, when it went quite high in January to March, people feel unwell and they think of malaria and they think COVID will come aggressively. But when it starts, it doesn't come aggressively. And so people kind of are a bit relaxed about their treatment for the first week. And then by the time we get into the second week, now they kind of become serious and recognize it as COVID. And by that time, it's become a bit more problematic. But if we were to recognize it early or consider it early, I usually actually advise that patients should test for malaria. We have the rapid diagnostic tests, which are quite high sensitivity, I think. And so if we have the suspicion that it's malaria and we actually check the test and it's not, at least then you consider going for the COVID test, seeking treatment for COVID. And in the early treatment, COVID is not dangerous. We have to stop the spread. So how to stop the spread is the education we are giving, the advice of distancing, wearing mask. That advice cannot change. It won't change, and it will continue for the time being. As we discussed, we can't say when it will end. We believe it will end because there have been previous pandemics which have ended. But it depends on us and also on the finding of the effective vaccine. So we believe these vaccines we have are good. At least even if they do not totally prevent infection, they prevent you from becoming too ill, seriously ill. But the transmission goes on. And so until we are able to eradicate it by vaccination and our own hygiene, we can't stop. We can't stop, yeah. That's what I believe. Oh, as I said, now the journals are all open. Any COVID-related publication is free to view. You don't have trouble getting in. So some of the publications I researched into were this July 14th was the most recent one. You can get any publication online. There's also, we have experts, we have specialists. Usually we advise that you can be a young doctor somewhere. You could always, if you have access to consultants, you could call and ask for advice, like Dr. Notiadom does quite often. So that is one of the ways. And then the other ways is get the literature. It's there.
Well, I think the general conception is that a virus will not stop mutating. Once you try to challenge a virus, particular drug, a virus, it tries to change its genetic makeup and mutate to a new strain. So this strain is going to come up as we go on. But it's not so frightening that the fact that the kind of clinical manifestation that the alpha and the beta were causing is not so much different from what the delta strain is actually causing. You might have seen some cases in India that are quite frightening, but thank God we're not seeing much of this in Africa and Ghana per se. So it's not so much of a different kind of fact that of the clinical manifestation. So we shouldn't be too much of a worry, but the preventive aspect of the normal human practice, wearing a mask, and that thing should carry go on. Yeah. So basically, challenging research is got to do funding. It's got to do money. Without money, you can't do any kind. You heard me mention about Europe and us comparing Africa, would be Africa. So that's the idea. If you have money, you can do more research. If you have money, you can sequence more of this virus and say, okay, the next strain is going to this. You can predict. The idea of doing genetic sequencing is to know the kind of virus and the kind of mutation so that you can get a particular drug or to target where that particular virus. So one of the biggest challenges is money. The second challenge is that we are kind of interested in doing this vaccination. It's good, but what is the vaccine doing? What are we measuring? What are the marks? What are we looking at it? Are we vaccinating people? And people talk about herd immunity. What are we getting there? Once we don't vaccinate more people, we don't think of getting herd immunity. So it's all about money. We need to put in money, and I think this kind of rapid kits that can detect antibodies should be available. In Europe, it's available. You can even test it yourself to know whether you have antibodies or not. So that has been the challenge.
Hi, I'm Dr. Grant Ichampon, one of the attendees of the just ended course on COVID-19 management. It's been very educative and insightful, and of course, it was free. I'd like to encourage all healthcare professionals and providers to avail themselves for such opportunities.
Hello, good afternoon. My name is Dr. Adwaitia and I'm with Eurocare. This program or CPD with BHEC was very insightful, very beneficial. So COVID-19 is a new disease. We're still learning more about it. So education about it daily is very good. It was a free program, absolutely free, and it is good because we learned a lot, we benefited a lot from it being free. Thank you very much.
Hi, my name is Dr. Anastasia Bruce. I'm with Kolebu Teaching Hospital, and I'm glad to have been a part of today's program. I must say that this program has been insightful, touched on various aspects, and it's been very insightful. I also like the part that it was a free, fully funded event. I personally enjoyed it. And I want to say kudos to the organizing team.
Hi, my name is Dr. Grace Bachman, and I'm excited that I made it to be part of today's program. Personally, I think I've learned a lot, and COVID, as we all know, is something new. Every day there's a different thing coming up. There are new variants, new ways of management. I like the spectrum with which the program tackled the whole thing. And I'm also excited it was free. So I want to commend all the organizers and the sponsors. God bless you so much for giving all of us this opportunity to be a part of this program. Thank you.
Hi, I'm Dr. Musa from Kolebu Teaching Hospital. I attended this program here this morning that was organized by BHEC Africa. It was totally free, and then I would encourage my colleagues to take advantage of such programs in the future and then attend as well. And it was educative. Thank the speakers. I learned a lot on the management of COVID-19 through this program.